So it is my absolute pleasure to introduce the Honourable Mark Butler, Minister for Health, who is representing the Prime Minister today in opening our conference. We thank you for coming and making time in what I understand is a busy schedule today with Cabinet sitting. I would like to extend, on behalf of the 144 members represented here today, the warmest of NACCHO welcomes. Minister, we are impressed by your genuine interest in our sector and the way that even in your first speech to Parliament in 2008, you paid tribute to the local Aboriginal people, the Kaurna people, and acknowledged their strong attachment to the Port Adelaide district. Our sector also appreciates the way that your party, during the election campaign, took the trouble to work closely with us in costing 3 key initiatives in Aboriginal and Torres Strait Islander health. We expect to see them confirmed in next Tuesday's budget. Respectfully, Minister. There are, of course, the 500 Aboriginal health trainees and the measures to support renal health and in fighting rheumatic heart disease. We thank you for supporting those 3 bold initiatives. We also thank you for listening to us and for your commitment to co-designing them with us. But we do not envy the task before you. We understand that the burden of budget repair for the incoming government will be formidable, particularly with the cost of living pressures, inflation, and deteriorating international conditions. Your government will be leading the country through a period of fiscal restraint, which is certainly an unenviable job. But we do need to recognise that despite these economic considerations, we cannot close the health gap if the funding gap persists. It was estimated in May by Equity Economics as $4.4 billion per year. That's over $5,000 per Aboriginal and Torres Strait Islander person per year. We understand that the budget needs repair and that the likelihood of new funding beyond the 3 initiatives you adopted in the election will not be available. But we do ask that the government joins with us in developing other ways of closing the health funding gap, ways that do not necessarily require new money to be found. We need to focus on maximising existing funding, and we can start through structural reform. And central to this will be implementing the 4 priority reforms of the new National Agreement on Closing the Gap. For us, a key will be the commitment to co-design and, where possible, to get a fairer share of the mainstream funding, because we certainly aren't getting that now. But I know that your time is limited and that we do not have time to lobby you on these issues. Nevertheless, please remember that we have plenty of ideas to share with you in this respect, and we have been encouraged by your government's commitment to listen, and nothing demonstrates that more clearly than the promise to implement the Uluru Statement from the heart in full. You and your party must be congratulated for that brave move. Thank you. Minister, if I can invite you up.
I don't know, I feel a bit lobbied. Thank you so much, Donna, for that warm introduction. Can I, at the outset, acknowledge that we're coming together today on the lands of the Ngunnawal and Ngambri people and pay my respects to elders past, present and emerging. And in addition to acknowledging your chair, acknowledge Pat Turner, your formidable CEO, and Dawn Casey, who's playing such a terrific role working with me on the Strengthening Medicare Task Force, a real champion, particularly in primary care. I know they are long meetings, Dawn, very long meetings, and occasionally a little contested and testy, but but your voice there and your wisdom is incredibly valuable. So thank you for the time you're taking to do that. I understand that this is your first meeting in 3 years, and as I go around and address a number of conferences like this, you can tell just how enthusiastic people are to get together again face to face. I mean, it just is so qualitatively different to meeting on Zoom or Teams or whatever else you happen to be on. It really does allow you to test ideas and learn from each other, and apparently tomorrow night do some karaoke as well, which I'll be sad to miss because I do thrash out a particularly good Burning Love from Elvis, which we should note in the diary maybe for next year. I'll make sure I'm here if you allow guests to compete as well. But I congratulate you on being able to pull together a conference again face to face. Donella was at the first Health Ministers Roundtable for 3 years that we've held for Indigenous health the week before last, and it was a terrific meeting, went for several hours. Donella opened with a terrific, unflinching speech to all of the health ministers from all of the jurisdictions there, and it was a great opportunity for many of us really to spend some quality time, not just not speed dating, but actually spend several hours really getting into some of the nitty-gritty of issues that your organisations confront every single day. So I know what it's like being able to get back together after several years apparently living on Zoom. I also want to bring apologies and greetings from the Prime Minister, who was invited here today. He's hosting a state visit from the Prime Minister of Singapore right now as we speak up the hill. But he proudly leads, as Donella said, a government that's committed to the implementation of the Uluru Statement from the Heart in full. Firstly, with a constitutionally enshrined voice to Parliament. And to those out there in this public debate that try to draw this false distinction between symbolism and practical effect, I say, and the Prime Minister says, and I think you understand so deeply, that not only is this the proper symbol of respect and recognition, but practically it will also lead to better outcomes. Because we know that this sort of engagement, listening to people who are affected by government policy, will improve that government policy. And I know that to be the case in the area of health, as it will be in so many other areas. And as Donella said, that critically important work to which we are so committed with a referendum in this term of Parliament will build on some of the incredibly important work that Minister Burney is leading for our government in the Closing the Gap agreement, with a number of reform priorities. And at the Health Ministers meeting a couple of weeks ago, I talked about my commitment and Assistant Minister Malandiri McCarthy's commitment to have a look at particularly reform priority 2, which has been left on the back burner for too long, frankly, and that is to build Indigenous capacity and to ensure as far as possible that Indigenous services for Indigenous Australians are delivered by Indigenous-led organisations. And to that end, I've asked my government to conduct an audit of all Indigenous services in my portfolio of health and aged care, with a view to determining why any of them would not be delivered by an Indigenous-led organisation. And as I said at the Health Ministers meeting, the first cab off the rank, in my view, is the Puggy Hunter Scholarship Program. I mean, a scholarship program named after the first chair of NACCHO, but has been delivered for years and years and years by a non-Indigenous organisation. Delivered ably, but if we're true to that reform priority number 2, I've instructed my department and that organisation to start a transition plan for that scholarship program to be transitioned to an Indigenous-led organisation. And we'll be working program by program, organisation by organisation in the Indigenous health portfolio to be true to that reform priority number 2 that we all signed up to. And of course, there is no greater example in health of Indigenous-led service than the community-controlled health organisations or community-controlled sector, which you are all such an important part of. I want to applaud and pay tribute to your work, particularly over the last 2.5 years. I know how difficult it has been and how utterly conscious you have been to protect particularly more vulnerable members of your community from this dreadful pandemic, and you have done just a terrific job. just an outstanding job, not only of protecting the vulnerable, but rolling out vaccination programs in sometimes incredibly difficult circumstances. And it seems to me that there has been a really strong partnership between the community-controlled sector and my department over the course of that. And long may that continue. I hope that that's a foundation on which we can build as we emerge, at least from the emergency phase of the pandemic, and over time from the pandemic entirely as well. But it's not just the last 2.5 years that you've been doing this work, it is almost 5 decades. And that's why, as Donella said, you were the obvious first port of call for the Labor Party as we started to think through our election commitments in Indigenous health, to come to you for great ideas, to pilfer them, to put our front page on them and present them as our election policies, but to commit to sitting down with you and co-designing what they would look like in government. And we are utterly committed to the implementation of all of those policies. It's one thing to design them and to put them into paper and to promise them at the election. They won't all be easy to implement, we know that. We're going to have to sit down with you, particularly led from my perspective by Malandiri from the government, sit down with you and work on very detailed implementation plans. Delivering 500 additional Aboriginal health workers and Aboriginal health practitioners is going to be a mighty achievement, but it's not going to be easy, and we know we're going to have to sit down with NACCHO, with other Aboriginal community-controlled organisations and your RTOs to make sure we get this right and we deliver that additional capacity into your sector. We'll double the funding to the community-controlled sector for the scourge of rheumatic heart disease, an area where Pat has been such an inspirational leader, but so many of you are working so hard as well. And delivering the additional 30 4-chair dialysis units, again, that's not going to be easy. We're going to have to sit down with you and make sure we get the planning right, the location right, we're able to staff them right. Where we need water infrastructure work, that we do that right as well. But I'm really looking forward to this work. I'm really looking forward to working with you closely. Malandiri will be taking particular leadership of this, of course, but we'll be working very closely as a team. I want to thank you for the invitation to be with you. I look forward to the karaoke next year. I'm going to go away and practice that a little bit and think about a couple of other Elvis tunes I might be able to belt out as well. But seriously, all the very best for your conference. I look forward to working with you in the future. Thank you.